Warm greetings from Ayurvedic Institute of Ayurveda, Private Limited, Kozhikode, Kerala. Welcome to today's free introductory session on clinical application on Marma and bandaging. The introductory session is the part of a 2-month certificate course, RACHANA. It is a clinical-based complete class on upper limb, lower limb, and spine. It covers from basic to advanced level treatments. The classes includes case discussion and basic injury management, including Marma and bandaging with live demonstrations. The course have 5 modules, including 23 live sessions, which will be covered in 2 months. Our faculties for the sessions are Dr. Suresh Kumar, Dr. Saifuddin Gurukkal, Dr. Jiku Elias Benny, Dr. Praveen MP, Dr. Shibu Varghese, Dr. Vinod Krishnan. Coming to today's session, our faculty is Dr. Saifuddin Gurukkal sir, the eminent personality in the field. He is working as the Associate Professor and HOD in Department of Shalya Tantra at KMCT Ayurveda Medical College. He is currently the Medical Director at Ali Gurukkal Shafi Ayurveda Hospital, Chelavur, Kozhikode. We are immensely happy to have you here as your faculty, sir. On behalf of Ayurvedic Institute of Ayurveda, I cordially invite you to the session, sir. I also welcome each and every one of you to the session.
Namaskaram. And today's topic is mainly one session we are going to discuss about the Marma Chikitsa. Most of them are practicing the Marma and Chikitsa. And here, one second, my Guru is calling. Hello, sir. Okay, so most of them are practicing the Marma techniques, different stimulation, manipulation, etc. And here, anyway, what I am going to discuss today here, very few points related to the part. And apart from this, will give some brief idea how the session is going to plan to discuss in future 7 days and other faculties, especially my 7 days classes also. We are giving hands-on training through our online section. So people will think, doctors, you are getting confusion, how we can. So in the olden days also, we were thinking when Corona started, people can't come and get trained. So we started through online also. So how much it is possible that we'll discuss in the online. And when the practical session is coming, you should utilize, open your camera, and so that I can see, and wherever you are getting doubt, you can raise your hand, you can open your camera, as well as in the, you can unmute and you can ask the doubt and we'll clarify like that. Okay. So we'll do like that today after the session presentation. And one of my, we have one guest today, and Dr. From Jamnagar. She came here for the PhD thesis on Marma Chikitsa. And still, doctor also will give 5 minutes to 10 minutes around the application of Marma Chikitsa in different view anatomically, how we can correlate. That also will give more beneficial for you, those who are beginners especially, and those who are practicing also, the different view we can think and we can practice. So we'll start with the topic. We all are knowing in the Marma and especially in the Prashta Pradesha. Before going for the Marma, just briefly we are giving this vertebral column. We all are knowing cervical, thoracic, and the lumbar. And coming to the disc, we all are knowing how the disc will be there, annular fibrosis and nuclear pulposus. I'm not dealing that much. And just go telling about the stages of the disc bulge and sciatica, and everything is coming. And we should think about the patient condition and where it is starting, where it is ending, why patient is having this type of patient condition, whether it is Marma, whether it is Bhagna or any pathology. Likewise, if it is in the cervical, and if it is in the lumbar, any other part. Okay. So we all are knowing the cervical, the how the X-ray is there. I'm not dealing about the X-ray, but I'm showing here. You should think like this. The X-ray, the position is there. Whether this patient we can go for the manipulation. If you are seeing different type of manipulation in the cervical, and if you are doing the 10 patient, 9 patient will not suffer any difficulty. But one patient, it will go for complication means, that means it will get the negative impact on this. So better whenever we are going for the Marma Chikitsa manipulation, take care before going for the present manipulations. Okay, to understand that, I am telling about in the canal stenosis, all those things, it is very difficult in the cervical. Demonstrate today cervical. Okay. So you have to go through this X-rays. Okay. If you want, after this session, I will give this one also. No problem. And whenever you are prescribing the X-ray, before, if you are suspecting there is some problem is there in the cervical, and we should think about the patient present condition, and we should take the X-ray in the adequacy of, if you are taking the cervical, all 7 vertebrae should be preserved on particular area. If it is coming 3 or 5, this area lateral view, it is not a adequate one. Okay, this is inadequate one. You can see this. Okay, so when you are prescribing the X-ray in the proper view, epilateral view, all this view we should know, and you, after getting the X-ray, you have to go through this. Okay, and the alignment, etc. Okay, I'm not dealing about this because Marma is such a wide subject. And another thing, whenever you are getting this type of patient, don't go for the manipulation. There will be getting chance of the fracture on different areas. Okay. And another thing, here arthritis will be there. In canal stenosis, you are doing spinal canal stenosis. After taking X-ray, we can see here the canal stenosis. Okay. This type of condition, if you are doing the this one manipulation, it will not give, it will go for complications. So what I am going to tell here, when you are doing the manipulation, selection of the patient is very, very important. Okay, this is a cervical rib. If you are going for this manipulation, it will not give a result. Okay. So introduction of Marma Chikitsa. There is a Marma stimulation and manipulation. We are doing different conditions. And the fracture and dislocation during the management, we are not doing any anesthesia. Just we are pressing over the Marmasthana, then we are doing the manipulations. And history taking is very important. You are getting any patient with the old history, Hedu, Linga, Aushadhi, in Ayurveda also we explained in Kalari Marma Chikitsa, especially when patient is coming, we used to ask this type of questions. Anything happen in Malayalam, we are telling, any history or old history, it may be sudden, it may be chronic history of fall like this. So when you are reading the manual of Clinical Das book, you will get to know. So why I am telling all those things? Because we are studying limited period. We are not studying more. My father was with Guru more than 30, 40 years with the day and night. But we are not ready to study like this. Only after studying 5.5 years and another, we are going for 1 day or 2 days, something is there. Capsule form, we are going on behind that. We are not studying properly. Okay, being a medical student or practitioner, we should think like this. Then only you can treat the patient without any difficulty. I'm not telling all the patients should not be sent for the X-ray. All the patients should not for the MRI. But wherever you are getting doubt, you before going for the manipulations and stimulation we can do. There will not be much problem over that. But the manipulation you are going for that manipulation, you confirm with the selection of the patient is very, very important. So if you are asking to the patient, is there any history of trauma? The patient may not be able to explain because they may forget this. But after seeing the particular area only, they can able to tell there is a history of trauma 6 months or 1 year back. Okay. So you have to repeatedly you have to ask whether it is onset is sudden or it is onset is chronic. Okay. Because after knowing the history, you go connect with the Lakshana of particular Marma. Okay, there is a, if Mamsa Shosha is there, there will be wasting of muscle is there, and there will be injury to the Kakshadara. There will be in the Lohidaksha, Pakshavada, and as well as this one Mamsa Shosha and Swaba, the numbness will be there in the Asti Marma. And here also Kadigadarana in this back region. Likewise, the different area explained the Sushruta beautifully. He explained about the Vidya Lakshanas. That also very, very important. So that's why I'm asking, whenever you are getting this type of patient back pain along with the what Vidya Lakshana explained, and if you are suspecting, you concentrate on the Marmasthana. Is there any history of old history of Marmakshada? If it is Kalandra Pranahara Marma or Vaikalligara Marma, and there will be getting chance of injury to the particular area, that will not, person will not die immediately. Okay. I am telling to the beginners, okay, about this point. And first examination, see the involvement, internal anatomical structures, bones, ligament, tendon, etc. gradings. And we should think, because sometimes we may tell only there is a Marmasthana, that is why. Before you are telling for the Marmasthana, whether is there any history of fall, is there any fracture, dislocation, or any other neurological impingement, what all the structure is present particular area, we should have brief idea. Then it will be easy to manage this type of cases. Okay. And today also I got one patient, a child around 7 years, and the female and 7 years. And she is not able, I forgot to take video because morning time, little patient is very less, but we are busy with some other work. So in the class and discussion, so I couldn't take video. And child is not able to turn one side. The child neck is completely turned to one side because she fell down on the bed yesterday night 2 times. So there will be getting chance of direct pressure is coming. There will be shaking happen in the neck region. And there is getting chance of the Marmakshada as well as in the fracture. But after the examination, I excluded there is no other fracture and dislocation. Then I asked, is there any massage you applied on the particular area? The mother told, after 12 o'clock also she fell down, and 3 o'clock also. Then again, after second time, what they did morning, they kept oil, they did hot fermentation and massage. Massage and hot fermentation contraindicated in the onset of sudden onset. That keep in mind everywhere. If you are seeing the football players, if any injuries happen particular area, what they will do, they will put only the ice pack. This is very, very important. Other than our knowledge, we should have the common sense. That is very, very important. Being a doctors, we should have more common sense. Okay, sometimes we may apply the hot, the kidi or any, then if you are applying kidi, then only you will get money. If you are doing any dhara, dhanyamla dhara, then only you will get, but where you should put all those things, that is very, very important. In the onset of sudden onset is that don't put any heat application. You can apply the simple jaladhara, ice pack or shidadhara, shidadalepa. That is very important. You make a underline in the paper wherever you are writing something. Okay. And your mind also always, any part of the body, it may be head region, it may be any other part, there is no other fracture, even though there is not a Marmasthana, immediately should keep the ice pack. Don't go for the IR or any other heat application or Padasveda, Nadisveda, etc. Then today morning we did small traction both sides. Then after that, she is able to turn right side, left side. Then mother parents are okay. Then I told you just do the leba with egg white, Marmani leba with egg white. And if the swelling is more, you apply little Eladigana churnam also. So I'm telling here, whenever you are getting patient, don't go for all the patient manipulation stimulation. On the basis of the injury or on the basis of the patient condition, we can apply the different way of the Marma Chikitsa. Marma Chikitsa will include, I am going to tell about, and usually we are doing the cervical, thoracic, lumbar and other joints manipulation. And Marmakshada, ice pack and Chitadhara, water there and bandaging, we can. The Marma Chikitsa will include Marma stimulation, Marma manipulations, then the Marma Adangal Prayogam and the Marudattu, then the bandaging, Lepa, Dara, all those things will include in the Marma Chikitsa, not only just the stimulation. Then coming to the thoracic region, and there is a AP and lateral view. You can see whenever history of fall is there, you take only in the lumbar view. No, thoracic lumbar area. Usually history of fall is there, especially in the height. There is a getting chance of fracture on the thoracic lumbar area. Okay, this way a lateral view also you can see the size of the vertebra. You can see. I'm going to tell here. Here you can see the size of the vertebra is reduced. Okay. Here this is normal and this one is abnormal. Here also you can see compression fracture of the thoracic. Coming to the Prashta Marma, we all are knowing the Amsa Marma, how to keep, if you are keeping your hands, just keeping in the chest region, flex elbow position, touch over the Amsa Marma. There is a meeting point of head as well as the neck region. Head and the shoulder where meeting is, neck is coming now. This area is Amsa Marma. Okay. About this Amsa Marma is a type of, I will explain one or two Marmas. Then I will come to the cervical region. Okay. And other things I will explain, but I will demonstrate only cervical because that means needed in, especially in the one area. Okay. And Snai is a type of Snai Marma and it's a Vaigaligara Marma between the neck and the arms on the trapezius area. On the particular area, we have to see this any injury or swelling. If it is chronic, you go for Snayana Sweda and Lepa. And if it is a sudden onset, directly we can go for the stimulation. And you are doing the stimulation means directly you see whether this marma is a Snayu marma, whether it is a Sira marma, whether it is Asti marma, Sandhi marma. If it is Asti marma and Sandhi marma, we can do the manipulations and stimulations and the vigorous massage also in the Asti, Sandhi and Mamsa. But coming to the Sira Marma, don't go for vigorous massage and that will, instead of giving energy, it will block the circulation if you are giving more pressure over that area. Okay, this is Amsa Marma in between this area, around fifth area, and these are all the muscles which is coming this area. Okay, there will be, you come to this, there is Tatra Stabda Bahuda, result in the rigidity of the particular arm. In the olden days, the people are keeping the fish. When it's big is, this one is there, no? Bamboo stick will be there. They are keeping this area. I don't know, in your place, they are doing like that. Or in our area, Kerala, they are keeping the bamboo, big stick, and both sides they are selling the fish. In the olden days, that time, this bicycle, there is no other facility was not there. Olden days, more than 20, 30 years. But they're having strong muscles. But nowadays, the people are using the even bag also in the particular area in this Marmasthana, in the ladies or somewhere. Even if you are using heavy weight over this area, there is getting chance of injury to the Marmakshata. Not only by hitting or something. In the martial arts, so the people are doing the Marma Prayoga or Marma locks or any other after Meitari, Koltari or Angatari we are doing, the person will get injury on the particular or Marmakshata will get. If you are coming to the person or sportsman or normal person, there is getting chance of this type of injuries. It may be direct abhigata, it may be this type of bearing the heavy weight or bearing the heavy weight on the Amsa Marma. Okay, so this way, if you got this type of patient, even the neck region, the cervical spondylosis also, we can do in the IVDP cases or we read it into the radiculopathy, cervical hand, it may be right or left. If there is no other neurological impingement, how we can manage? If neurological impingement is there, how we can manage? Without this, how we can manage? Everything I'll demonstrate here and I'll give chance hands-on training for you also. Okay, so coming to the another marma. Amsa Faraga Marma. You hold your hand like this, L shape. Okay. Then keep your hand like this. Okay. It will touch where it is touching. That area is Amsa Falaga. It's a type of Asti and Vaigaligara Marma. And half inch lateral to the 5th, 6th, and 7th cervical and 1st thoracic. That area is coming. Okay. Anatomical structure, it is almost correlated. Whenever you are doing the different diseases, on the basis of that, we can, if the radiative pain is there particular area, and you can, when you are applying the Marmakshata is there, when you are applying the Leba, you have to cover the Amsa, Amsa Falaga and Brihadi. One Marma above, one Marma below, all 4 angula nearer Marma also we should apply the Lepa, Dara, etc. Okay. And here I'll told no, if any injuries happen, Asti, even though it is a Asti Marma, Baho, Swaba, Shoshova, injury result in the emaciation of upper limb. If you are getting any type of one limb is emaciated and you have to ask any history of any RTA or any history of Abhigada, If the police station person is keeping, they are keeping the person in pen, they are hitting to this Marmasthana in the Parshasandhi and the Brihadi. Sometimes they are beating in the Amsa also. Some person is beating from the backside or giving punch. Okay. Any type of it, direct, it may be a fall or any other cause. Abhigata is a single word we can tell. So afterwards also this type of, I go through like this each and every simple marma, any disease is there, just doing stimulation? No. Think like this. And coming to the Brihadi marma, it's a type of Sira marma. Usually the therapist, in your hospital also therapist will be there. They used to do whenever radiating pain because of the cervical, it will come to the Amsa and Amsapalaga and Brihadi area, subscapular area. Usually the therapist, what they will do? They will do vigorous massage over that by using the thumb finger. It's a type of Sira marma. Subscapular artery and veins is passing the particular area. If you are going for the vigorous massage, and it will go for injury to the particular marmasthana. Usually in the olden days, nowadays also, after doing so many work, because of strain to the neck, there will be radiating pain to the hand as well as chest region and the subscapular area. The mothers or ladies, what they will do, wherever the sharp area is, the edges of the wall or edges of the door, they will keep their area, Brihadi marma, then they will do rubbing over that area. Sometimes the parents also will tell the children, you do the beat or else you walk there or any other instrument you can use there. At that time, they will feel relaxation. If you are going for the barbershop also, they will do the vigorous massage over the Amsa marma, Amsa Palaga marma and the Brihadi marma. After 1 hour or 1 day, you just observe your feeling, observe your body condition, how it is. It will be very difficult to rotate and the pain will be increasing. Okay, 3 inch above the inferior angle of the 3 or 4.5 angula above from the inferior angle of the scapula. You just palpate your inferior angle of the scapula. This 4.5 angula above, you will get the medial shaft of the scapula and the medial border of the scapula. You will get to know. Okay, I will demonstrate one by. Okay, you sit here. She's Dr. Jasna and my wife. Okay. And this is the meeting point of head as well as neck region. This marma is Amsa marma. I think is not okay. Now it's clear, no? And here 3 angula below, if you will get the Amsa Falaga. From Amsa 3 angula below, you will get Amsa Falaga. This, if you are measuring the which marma? Inferior angle of the scapula. Inferior angle of the scapula, 4.5 angula above and medially, you will get the which marma? Brihadi marma. It's a type of Sira marma. Okay. And when I am demonstrating the cervical manipulation, I will explain once again. Just explanation of theory. I'm giving brief idea. Okay. So this way, another way patient will get pain over that. I'm telling about that not only by injury or radiating to the cervical or any other marmakshata happen particular area. Patient may feel big other than this cause. There is a chance of the, what are the chance? Anyone can tell? Any other condition patient will feel pain here? Put it in chat box or you can unmute and you can tell. Mainly why we are doing.
Sir, what is the question?
Subscapular area, patient is suffering from pain. Anyone is knowing why patient is suffering? Right side subscapular area, especially in the female.
Polylithiasis.
Yes, very good. Doctor name?
Amarnath, sir.
From where?
Tirupati.
Okay. Fine. Then this way we should think about this marma. So nowadays we all are practitioners, but we are writing only. We are not seeing the therapist room when they are performing the treatment. My suggestion is that during the procedure time, you just observe how they are doing. If possible, do small marma massage over that particular area. Patient is satisfied. And what you are doing after seeing this patient, how to perform, the therapist also know how much pressure is. Then only you will get result. In our area, after completion of my BMS also, my father used to tell, you go and do this. Then I was thinking, some people are asking me, why you are going for therapist room? You are doctor, no? You are MD doctor, no? Then why you are going for that? Then I told, I'm studying Kalari, I'm teaching Kalari, I'm going therapist. If people are, two things are there. If you know all the procedure, you can tell to others. If you are not ready, you go, we will do. Okay. Another thing, if you are applying the pressure other than therapist, you are knowing the marma and the other structures and patient condition also. On the basis of that, you can do the marma massage. If you are using by hand, and when last time we demonstrated in the Kottakkal Ayurveda College, the doctors are different area certificate course they conducted. I did Padagata. The doctors were asking in our gurus, Dr. Vinod Pattab is expert in that, and other gurus, Dr. Srivastava sir and Dr. Suresh sir, and different area we are telling about this marma, and not only in the Kerala and other area also we are exploring the marma chikitsa. Our aim is everyone should practice with the proper knowledge, and they should develop their own center. Okay, I'm going to tell here, the pressure is coming by, even though if you are going for hand, if you are moving with the foot also, patient will not feel any difficulty. After the treatment, massage, marma massage, patient should feel complete relaxation. Whether you are going for flexibility, whether you are performing the massage for the rejuvenation purpose, whether you are going for the disease purpose, especially disease purpose, you take care why we are performing the massage, or whether we should directly for labor, whether we should directly perform the banda, all those things. Because last time I got one patient in KMCT college also, and the mother is around 65 age. She is not able to the disc protrusion. It was severe pain. I told them, just put bandage only, Murivanna bandage. Don't go for anything else. If the Vada vitiation is there, do just Matra Pasti. We are not doing it. First we taken Snehana Swedana, then Banda. After that, till night time also there is no pain. Because of gas problem, there will be getting chance of the pain on the lumbar. Okay, 3 o'clock. And now, yesterday also, patient is comfortable. There is no avibirida bando vedano pashantihi. So at that condition, back pain is the protrusion is there. After studying, if you are doing manipulation, again pain will increases. You have to see the patient Rogi Bala and the Roga Bala. Roga Bala means which state it is, whether it is grade 1, 2, 3, 4. On the basis of that, we have to perform the manipulations. So here it is coming to the Brihadi Marma. Brihadi Marma mainly this area, someone is using the this one, and the marker is coming. Doctor, please check that why it is coming. Okay, and this area, subscapular artery and vein is there, and the Shonida Adipravarti Nimitta and Ubatravarmiyate, and there will be internal bleeding also. They will be getting chance, and patient will go for the death also. And Parsha Sandhi, again, it is a Siramarma. I'll just tell about this because I am concentrating on the cervical only. Just Parsha Sandhi, this area. If you are keeping your flank, this area is the Parsha Sandhi. And Kukundara sacroiliac joint, the Sandhi Marma, Vaigaligara, marking on either posterior superior iliacs on both notches. And Sparsha Aknana Adaha Kai, Chestobaga, injury to loss of sensation, paralysis, lower part of the body. Coming to the Kalari Marma, if there is injury to the particular area, and there will be Arathalapan Marma is explained in this particular area. The same with the Lakshana told by the our Sparsha Aknana Adhakaye Chesto Bagadascha. If you are coming to the Gridrasi also, Sakti Shebana Nigaranabi also explained. Okay, so compare the different way, different view, and what they explain why you are doing all those things. And immediately in the Kalari also they are explaining immediately injury happened particular area. Patient can walk, patient can sit after taking X-ray, nothing is there. But you know this Marma, Kukundara Marma, Kadigadarana, Nidamba Marma is Abhigata is there. If you are not treating, patient will go for this type of complication. Treat it initially, then it will not go for any complication. Acharya explained in the Kalari, not Acharya, not Susmita. I am telling about the Kalari Marma Chikitsa. They explained the immediately we have to release small manipulation. Just you do the pulling, because direct pressure is coming in the lumbar area, thoracic and the lumbar area, it will compression, then do just relaxation. After that, do the ice pack or Shida Dara, Shida Lepa, then you nothing is there. You keep your Murivanna, keep it in the fridge and apply over that area and do the bandage. And there will not be any accumulation of fluid. There will not be any other deformity or degeneration. We will not go for that. People are not doing like this. In the olden days, the parents are knowing if any injury happened, nothing is there, even they will take you to the Marma Chikitsa center. And those people are having knowledge of Marma. Just in the board, Marma Chikitsa is there, you are going there and sending to the patient, or this is not a treatment. Okay. And this type of Kukudara Marma and Nidamba also is explained. Adaha Kaya Shosha, Daurbilya Samaranam. Adaha Kaya Shosha patient, sometime there will, after taking X-ray, MRI, nothing is there, but patient is a weakness and as well as emaciation over the one limb because the Vidalakshana to the Kukudara Marma. There will be chance Nidamba Marma. And Kadigadarana Marma also. Shoni Dakshaya, Pandivi Varma, if any fracture is there, there will be blood loss will be there and patient will not go for death also. Okay, it's a type of Asti Marma, and these are all the brief idea about this. And one thing I want to tell you before going for the manipulation over the Adangal prayer over the thoracic region. Usually, that also I will demonstrate you. Okay, and two things I'll teach you here. We have enough time now, I think. Okay, it just injury directly happened. There is no other fracture. Keep the patient opposite. How to do Adangal prayer? One thing, and another thing, cervical manipulation stimulation. Okay, right? And this patient lady around 60 age patient came, she while getting down from the steps, and there was no any other this one, while getting down the step, there was no holding in the first floor. She fell down because of fainting or something. She fell down in between the two steps. Okay, then suddenly she fell down, and she is not able to turn, not feeling proper respiration. Patient is difficult for breathing, and came our hospital. We didn't have any X-ray. So after examination, after taking history, we came to know there is some fracture. So immediately we sent this patient for Government Medical College, Calicut. Okay, because our diagnosis, there is a chance of fracture over the thoracic region, especially, and patient is having more tenderness over the thoracic region, in the Prishta Pradesha, and the chest region also. Okay, there is rib fracture as well as in the spine fracture. We are suspecting. We sent this patient for X-ray. After taking X-ray, they told after 1 or 2 X-ray they taken, they told nothing is there, and repeated X-ray they taken. Then they told there is some fracture over this one. Then taken after that CT also. There is a right mild pneumothorax, bilateral minimal hemothorax, multiple bilateral rib fracture, right pulmonary condition as described, multiple vertebral fracture is there. Vertebral fracture is there, rib fracture is there. Why I am showing this X-ray here? Whenever you are getting patient, before going for diagnosis, you should not, before confirming there is no fracture, exclude one by one. There is no fracture, there is no other complication. If you are performing the Adangal Prayogam, patient is difficult for breathing, bringing back into abnormal condition into normal condition. That is nothing but Adangal Prayogam. Okay. But the thing is, your diagnosis is wrong because you are not taking X-ray, you are not taking a CT, but you will came to know after seeing so many patients, whether this, after studying this type of classes and knowledge, and if you are seeing so many patients, you will get to know idea where we should apply all those things. Otherwise, don't go for that. Okay, so you need the theoretical Dakshastirthartha Shastrartho Drishta Karma Shujar Bishak. Then only you can perform this. Some people are practicing, might have practicing, and you can improve your knowledge. Tad Vidya Sambhashana, Sadada Dhyanam, everything is explained in our context, science also. Okay, so always utilize this opportunity wherever, whenever somebody is doing discussion and participate. You all are busy, we all are knowing, but the Ayurveda is this one team is doing this type of sharing the knowledge. One thing we can do, we can't share the money, we can share only knowledge. Then if you are performing this type of Marma Chikitsa, our Ayurveda science will develop. You can also develop. Okay. And the thing is, before going for the manipulation or Adangal Prayoga, you have to confirm it. Your diagnosis should be perfect. If you are not taking X-ray, MRI or CT also, your diagnosis is perfect. If you are suspecting, you can for that. After that, you can do. We didn't perform any manipulation in this case. We did only bandage. 45 to 2 month patient was completely bedridden 1 month, and Kabada Shayana, urine with under catheterization, and feces was passing to the tablet. Means we made a hole on the lie down patient is alive, where the patient is lying down. No, we made a central hole also. And after that, after a sixth week, we made the patient sitting position, then standing position. Patient can walk, sleep. There is no other difficulty. We didn't take an after MRI. I think we taken. I will check it that if it is there, I will show you in the coming classes. Okay. And now patient is okay. Patient after 3 months, patient came for another difficulty in the old history of arthritis. Then we did a treatment. Now patient is can walk, patient can sleep. There is no other difficulty. If you are performing, there is a already the displacer fracture and condition is there. Again, you are performing the Adagal Prayogam or a manipulation. Then immediate patient will go for the complication, this one coma, and patient may go for death also. Always head region, spine, and other area you keep in mind, especially in the thoracic area. Okay. And these are the Marma simple stimulation we can do. Even patient is having cervical, just clockwise direction, you keep your Mudichi Varma. In Sara Mudichi, and the Tummal Mudichi, and the Pasa Mudichi, and Kuma Mudichi. In Tamil also they are telling. In Kalari also we are telling, do the stimulation from even patient is having cervical. We have to do cervical to lumbar. When patient is having lumbar pain, cervical to lumbar also we have to do clockwise direction. Amsa Falaga, we are coming to the Ayurveda. Amsa Falaga, Brihadi, Parshasundhi, Kadigatarana, Kukundara, Kadigatanidamba, and Kadigatana. Up to this area, we have to right side as well as left side, we have to do clockwise direction. I think you are getting this point, I'm telling. In the OPD, immediately after cervical stimulation, if you are doing like this, I'll show you how to perform. And definitely you will get a 500 rupees consultation fees. I used to tell everywhere, I am getting this. That's why I'm telling. Okay, if you are writing simple prescription, you will not get money like this and patient will not be satisfied also. Okay. These are all the, I think those who went for under Tamil Marma, you will get to know this. These are all the places. In Ayurveda, I didn't mention any Marma, this spine. Okay. And lumbar area also coming, there is so many things are there in the this one, and the pathology and degenerative changes that we will discuss. Coming to the our main Bandha Gunas. Here also you can see this one X-ray. Here the fracture is in the thoracic area, ribs 9. Okay, fracture. We did bandaging and it is completely healed. While video also is there, will come in classes. We can, after discussing my point, I can explain all those things also. Okay. And lastly, one thing I want to tell you, Marma is a simple one. If you are having proper knowledge of particular area, before this one, going for our stopping my presentation, and I would like to introduce my guest and Dr. And she will be able to explain. After this explanation, I will come to the thoracic manipulation that will teach you. One second. Hello. Hello. Am I audible?
Yes, sir.
Yes, sir.
Yes. Okay. 10 minutes. Our doctor will explain about the level of marma. How anatomy already the madam is in anatomy in the Jamnagar, associate professor, and madam is doing in the marma chikitsa in the lumbar area. And the vision when we are discussing, I told today you should tell this to the doctors, those who are practicing, those who are beginners. Everyone is thinking that marma is such a just a stimulation. Then her view and interpretation is very good, and she will explain on that. Okay. After that, we will come for the cervical manipulation. Okay.
Thank you, sir.
Mhm. Okay.
Thank you, sir. I'm Dr. Ipsita Panda, PhD scholar from ITR Jamnagar. I would have been associate professor if not in a regular PhD course. And I'll be talking about because I'm working on color in my PhD thesis only. I'm working on Kalari Marma Chikitsa and pain perception and pain modulation, and that too neurobiological and biochemical assessment. So I'll be talking about some of the structural points which we should envision, and while coming to this area with sir, discussing with sir, I thought of some things, and previously also there was some visions. So I'm introducing a topic, and I need your guidance in this because this is a vague idea at the point. Is structural analysis of marma points and marma chikitsa points same or different? When we are talking about acu points, many works you will see that there are histological works, there are anatomical works to prove how these acu points they are pressing and how it is working, and there are biochemical, anatomical and physiological and many histological points, and articles are there, and that's why TCM is a alternative medicine and we are a pseudo medicine. So now it's high time that we think in these directions. And I'll be talking about structural analysis of marma points and marma chikitsa points, same or different. Okay, coming to the topic, structural analysis of marma points. As we know, on view of Acharya Sushrut, we have correlated the functional and structural anatomy in many places. I will just go through one of the example like Manivandhe Kunthata we are telling, or Kunthata means loss of motor function of that hand at that point. If it is there is any traumatic injury, will tell that traumatic injury is there. So what will be the structures at that point which can be affected, causing motor loss function? Maybe not like median nerve, maybe not like radial nerve or ulnar nerve, which are passing around this structure, or maybe other vessels also. So there are multiple questions that it is said that it is sandhi marma. Sandhi marma means fracture of that wrist joint is causing some type of injury to the nerve or the vessels, which is causing the functional anatomy like Manibandhe Kundhata. Though, so the structural analysis, maybe the wrist joint is there, but which because it is a sandhi marma, or we it's told by Sushrut. But we have to differentiate why this functional anatomy is happening because of the structural discrepancy. And there is hello, am I audible?
Yes,
Am I-
ma'am.
Yes, ma'am.
And the second thing is that, as sir was telling today, why this structural anatomy is important in a view of a marma chikitsa person or a practitioner of a marma chikitsa. There are two things. If there is a sira marma or there is a sandhi marma, so the pressure which we will apply at sira marma, will it be same as the pressure which we apply at a sandhi marma? May not be like that, because if we apply the same type of pressure in what we are applying in asti marma or sandhi marma, it will cause venal the vessel obstruction if we or microvascular in hemorrhages, if we apply the same pressure in a Sira Marma or a Sandhi Marma or a Asti Marma, so the pressure application of pressure will differ, and we should know the structural analysis of Susruta for Marma Chikitsa point of view. Another thing, sir, also told me today that to decide where and when. For this, I'm going into a topic of Manibandha once again, because I'm taking it as an example. In Manibandha Kuntata, it may be due to trauma to the lower end of the radius and ulna, or any dislocation of this carpal bones, or it may be due to the compression injury in case of, we know, persons who are doing manual labor, and or many persons who are now working in laptop also. There is compression injury, and there may be carpal tunnel syndrome without or with compression injury. So there is a question that in trauma case, can we use can we do Marma Chikitsa? No, we can do, because in trauma case, if we are applying pressure, more pressure to that area, there may be other increase in fracture or dislocation. So we can manipulate, but we cannot stimulate the marma at that point. But in case of compression injury or carpal tunnel syndrome, there is two things we are simultaneously talking about. In case of carpal tunnel syndrome, yes, we can use Marma Chikitsa, but where to use? Should we use in this area, or should we use in this area, in both the sides, or should we use in the area which is related to the carpal tunnel area? Because two types of pressure sir is giving in this area. Sir is sometimes giving pressure, deep pressure in this area, and sometimes he is pressing like this into the sides. So in case of a carpal tunnel case, we know if we elicit or if we press this area, we will be eliciting this Durkan's test, or we can elicit the Tinel sign also. So should we press it over there in a carpal tunnel case? No, may not be. Because if we press in the sides, or if we press in the kurcha area, in the next slide I'll show you. Here you can see that the median nerve before 5 to 7 centimeter before it is entering into carpal tunnel, it is giving a branch, palmar cutaneous branch to the thenar muscles area, palmar cutaneous branch to the area skin over the thenar muscles. So if we press over this area, means in the middle of it, we may have a compression injury. We may elicit more pain in this case of compression injury. But if we press over kurcha, kurcha Sira place, in that case, we will be initiating the pain modulatory pathway related to the median nerve, but we will be stimulating a branch which is not related to carpal tunnel, and it is a palmar cutaneous branch. So knowledge of anatomy is too much important in this case, and we should think in this direction, and we should analyze and write our Marma points and Marma Chikitsa points in this view also. It's my one own idea and search idea. Sorry, someone is scribbling over this PPTs and everything. Please don't do this. We are all, I think, doctors. And another thing is that when and where to give pressure, I have talked about. And then I'll come into another point of view where we need, means in Marma Chikitsa point, we should do means anatomical analysis and biochemical and physiological analysis. And my paper is also related to, my thesis paper is related to this. If we know the anatomical basis of the places, any question from Rahul Raghunath or something, if you are skipping. Yeah, after this, I'll open the chat box after this, and this is my last slide also. So, yeah, by knowing the anatomical nerves, whichever they are passing over there, or the microvasculatures or the vessels over there, there are many pathways we are initiating pain modulation, like gate control theory. By rubbing also or by massage also we start this gate control theory of pain modulation, and there are descending pain modulatory pathway where opioid and cannabinoid system of pathways are working on, and body is producing its own endogenous opioid biochemical markers like endorphins and enkephalins and other things, and cannabinoid also anandamide and AEA type of biochemicals are released, which are causing pain modulation. And there is also autonomic component to it, autonomic component which is working on once again on descending pain modulatory pathway. We know that if you give a slap to a person in a crowded area, and or if you do it indoor, that pain or threshold will differ, or a pain perception of that person will differ. So that is a autonomic pain modulation pathway where insular cortex and other PAG and other components are being involved, and vagal nociception and other components are being involved. And after going through some classes in Marma Chikitsa, I came to know that we are giving hot fomentation or ice pack and everything. So we are initiating the TRP membrane proteins, where heat will go through TRP-B membrane proteins, and the cold pathways will be TRPM or TRPA. These will be initiated. So the physiological pathways are also, pain modulatory pathways are also being initiated. And then I want to talk about Wallerian degeneration and the nerve regeneration, because the neuralgia, nerve pain is of three types: nociceptive, or it may be neuropathic, or neuroplastic. So in case of this neuropathic pain, there are three stages according to Sedan classification, that there is neuropraxia, and there is exonotemesis, and there is neurotemesis. In neuropraxia, we know that like Saturday palsy type of thing, where there is no structural involvement, but there is signals to the brain is momentarily hampered, and after sometimes it reverses to the normal condition. But in exonotemesis case, there is a procedure known as Wallerian degeneration, where this cell autophagy is going on due to some proteins like LC32 protein and everything. And after that, nerve regeneration can take place. And it has been seen that in acupuncture and other physiotherapy and other things, this Wallerian degeneration process is being enhanced, and nerve regeneration is being enhanced after the therapy. So these are the biochemical markers which are also helping in our neuropathic pain and everything. If there is any question, you may ask. Thank you.
Yeah, I'm not enough. It's 9, but it's 8 o'clock.
8 o'clock.
Okay.
Can
I move to the practical now, madam?
Yes.
Hello? Hello?
Yes, sir.
Can I move to the practical?
Sure, sir.
Yes, sir.
Okay. We will start with our practicals. Yes. Is it visible now?
Yes, sir.
Visible. Okay. We'll start with the cervical manipulation and stimulation. Okay. You can see here, this is the meeting point of head as well as neck region. This marma is Amsa marma. Okay. How we are going to stimulate. This is a meeting point of head as well as neck region. Just we are keeping our 3 fingers like this. Okay. The thumb finger we are keeping in the posterior part. Same way, the neck region. Just same way, opposite direction also we are keeping our the right hand. Okay. Just press, release, press, release, press, release, press, release. After that, you have to knock like this. You just observe now. Now you open your camera so that I can see. In gallery view, I'll see. Okay, you just open your camera, and if you are having any demo, practice it. If you are not getting, I'll demonstrate once again, or else if you are showing your camera, I will correct it. Dr. Deepak sir, you have any demo?
No, sir. I don't have any demo, sir.
Okay, you keep your hand like this. Yes, okay. Kept in the Dugas test, how we are doing now on the opposite shoulder. Just keep
Just a minute. Just a
thumb
minute, sir.
up. Okay. If those who are not having, so this Dugas test we are performing now. Flex our elbow. We are keeping on the opposite shoulder. That is nothing but Dugas test. And you keep your hand just instead of keeping the shoulder joint, just keep over the Amsa Marma. Okay. Then press and release, press and release, press and release. If you are having pain on the neck region, stiffness is there, you can do alone. Okay. The same.
Okay.
I will demonstrate how to perform over the body or its patient. Okay.
Okay, sir.
So those who are having pair, you just do it on. You stand, Dr. Amarnath, standing position. Keep your thumb finger over the C7 area and keep all three fingers over the Amsa Marma.
Supraclavicular fossa.
Supraclavicular fossa you can keep
3 fingers on the supraclavicular fossa.
like this. Okay. Then
Yes, sir.
like this. Instead of keeping tip of the fingers, pulp of the fingers,
Pulp. Okay, sir.
press and release, press and release, press and release. So keep your finger over that supraclavicular fossa.
Yes, sir.
Okay. Keep nearer
Yes.
to the joining, Amarnath doctor, keep nearer to the neck region and the meeting point of the shoulder. Little
Okay, okay.
middle side. Amarnath,
Yes, sir.
press and release. Press and release. Press and release. Press and release. Okay. Amarnath doctor, you ask your pair how it is.
How is? It's
Okay.
good, sir.
Yes, very good, very good. Dr. Asmi Yadav. Yes. Keep your hand over the Amsa Marma. Right hand over the right shoulder. Right hand over the right shoulder. Left hand over the left shoulder. I'm not seeing that properly, how you are performing. I'm seeing your face only. I want you to see your hand, how you are performing.
I have 1 minute.
Okay. Then Dr. Bhavana, you stand and make the patient sit in position. Make the patient sit in position. Patient sit in position.
Sir, 1 minute just.
Okay.
नहीं,
Dr. Deepa.
Correct.
Yes, sir.
Yes. Do it. Keep your right hand over the right. Yes, very good. Okay. Properly 3 to 5 times you just do and ask the person how it is. Both side you do. In the cervical, the one thing is Ida and Pingala is there, Sushumna is there, no? Whenever the neck region, right side is pain, you have to do both side. Both sides simultaneously. Ask the person how it is, Dr. Deepa.
Yes, sir. He said he is feeling better.
Feeling better. Okay. Next, I will come to Dr. Asmi Yadav. Okay. Open in the pair is there. Bhavana doctor. Okay, you are getting?
Yes, sir.
Yes. Ask the person whether he is feeling pain or not.
Are you feeling pain? She's feeling relieved, sir.
Yes, yes. Okay, okay. Asmi Yadav. Doctor
Sir, she's feeling relief.
Asmi Yadav. Okay, okay, okay. Don't give much pressure. Thumb finger you should not press. Okay. Thumb finger you give support only. Asmi Yadav, doctor. You just
Okay.
put on the front side. You just see here my hand. Front, you just see my finger. I am keeping my thumb finger. I am not moving any my thumb finger. Just press and release by using the 3 fingers like this, front to back.
Okay, sir.
Okay? Do it like that. Don't make it painful. And Hari Krishna, doctor, both side you keep your hand. I'm not seeing Dr. Hari Krishna. Ah, yes. Hari Krishna, you are getting now? Do it. Yes, yes. Do it, do it. Press and release. Press and release. Press and release. Okay? Perfect now? Yes. Coming to Anuradha. Hari Krishna, okay na?
Sir, രണ്ട് സൈഡ് ഒരുമിച്ചാണ് സർ.
രണ്ട് സൈഡ് ഒരുമിച്ച് ചെയ്യണം.
Sir.
Yes, Dr. Anuradha.
Yes, sir. Doing, sir.
Yes, ask the person how it is. No, you keep your finger. You are using only finger only. Keep your palm little above. You keep your palm over the Amsafalaga Marma. Palm over the Amsafalaga Marma and press over the, by 3 fingers, you have to press over the Amsa Marma. Keep little above, little above, little above, you keep your hand.
Sir.
Yes,
Is it
now
right?
it is. Now ask the person how it is. Whether you are feeling pain or comfortable by doing this.
Yes, sir. She said okay.
Okay, okay, okay. Which place you are?
So from Hindupur, sir.
Hindupur.
AP.
UP. Okay, okay, very good. Dr. Jalakshmi, do it. Show your this one demonstration how you are performing. Do it. You are using by your finger. Keep your thumb finger over the C7 area. Thumb finger. Enter palm. You observe here. Enter. You keep your hand like this. Enter palm. You have to keep over the trapezius muscle. And front you have to drag like this. Press and release. Press and release. Yes. Minimal pressure. Don't give much pressure. Ask the person how we are feeling. Dr. Jalakshmi. Okay. You are an unmute. You can unmute and you can tell. Still you are in unmute.
Comfortable, sir.
Eh?
He's comfortable.
Okay, okay. Now it's okay now. Patient is getting relaxation now.
Sir.
Yes, okay. Anyone is doing? Anyone is having doubt? Next day, if your friend or your relative or your boyfriend, girlfriend or anyone is feeling this type of difficulty, you are not able to release that, you are sending for allopathic person, then you will not get name and the person will not come to you next time. Okay, so you practice whatever you are studying here. If you are not having any person, you are getting a doubt, you can ask also. This much is clear? Amarnath doctor, still doubt is there?
Yes, sir. How many times we need to squeeze?
On the patient condition, you can extend up to 10 times also.
Okay.
Per day, 1 time, 1 sitting, up to 5 to 10 times you can do. Press and release, press and release.
Okay, sir. Okay. Thank you.
Okay, coming to the manipulation. Okay, first you observe here how I am doing.
Please.
You observe how I am doing manipulation. Is it okay? Okay. This is the chin. This is the left side cheek. And this is the right side cheek. And this is the Adipati Marma. Just I am keeping my hands. Elbow I am keeping over the chin. Elbow I am keeping over the chin. Okay. Sit. Elbow I am keeping over the chin. Okay. This humerus I am keeping over the cheek. The forearm I am keeping over the cheek. Okay. Like this I am locking. Don't shake any side. Keep patient neck in the proper position. You have to stand side of the patient and back side. I'll show you how to demonstrate how to lift it. In the front you can see now. Okay. Back we are holding the neck region and the head region. Tell the patient to breathe in, breathe out. Breathe in, breathe out. While exhalation, breathe out time, you just lift neck region, keep it normal position. Just lifting and keep it normal position. Lifting and keep it normal position. Same way that side also. Okay. Tell this side. You can observe the back side, how I am holding. Okay. When something you want to lift means you have to lift from down to upward. Okay. Don't do like this. So we should hold the head region like this. Okay. Head region like this. And take the patient in the sitting position. Keep your hand like this. Flexed elbow position. From down to up. Same way how you hold it in the front side, no? Same way you should hold. From back to down to up, you have to lift and keep it down. Lift and keep it down. Lift and keep it in normal position. Okay? Now you take your pair. Thank you. Hello? Is it audible now?
Yes, sir.
Yes. You stand. You make the patient in sitting position. Yes. Lock it. Very good. Very good. And because one thing you keep in mind always, you should not keep your elbow over the hyoid bone. Ask the patient, you are comfortable or not. Okay, comfortable. Lock it properly. Don't do any shaking and sudden movement, sudden jerk. Posteriorly, you have to keep on the meeting point of head and neck region. And the Vidura Marma, that Marma should not press. Okay. Then slowly you have to lift. While exhalation time, tell the patient to breathe in, breathe out. Breathe out time, you should lift. Lift, keep it normal position. Lift, keep it normal position. Lift and keep it normal position. Ask the person how you are feeling.
Comfortable. Comfortable.
Yes, immediate result you will get. And this type of manipulation and stimulation, if you are doing, patient will not feel any difficulty. Okay, immediate result, 100% immediate result you will get if the disc bulge is there. If the IVDP means disc prolapse is there and it will not relieve, complete relief will not get. After that, you can go for bandaging also. If it is LEPA, bandage, etc. Don't go for any massage. Okay. And Dr. Hari Krishna perform. Or Dr. Deepa is doing. Okay, do. Lock it posteriorly. While exhalation, lift and keep it normal position. Lift. If you are keeping your flexed elbow position, it will be pushing only. Patient will feel pain over the posterior part. Both sides you can practice. Hari Krishna, doctor, practice. Dr. Deepa, it's okay?
Yes, sir. Yes, sir.
Okay, now?
Yes.
Dr. Hari Krishna, do.
Okay. So,
Dr. Hari Krishna, elbow should be perfectly okay. Posteriorly, slowly you have to lift. Slowly you have to keep it down. Yes. Yes. Both sides you can do. Hari Krishna, doctor, okay, na? Okay. Dr. Bhavana Upadhyaya. Yes, hold it properly. Do it. Yes. Posteriorly lift it. Keep it down. Lift it. Keep it down. Lift it. Keep it down. Dr. Hari Krishna, okay?
That's what.
Dr. Hari Krishnan. Okay, now? Doubt is there? Okay, okay. Coming to the Dr. Jayalakshmi. You stand, Dr. Jayalakshmi, stand side. Side. Ah, yes, hold it. Yes. Posteriorly lift it. Tell the person to sit properly. Patient also don't move. Okay. It's okay now? Jayalakshmi is okay? If it is okay, means just do one thumb.
Sir, is okay, sir?
Okay. Ask the person. He is feeling something? Yes.
Okay.
Okay, Dr. Anuradha. No, you are Dr. Anuradha. Keep your elbow over the cheek. Chin. Elbow. You are humerus over right chin. Sorry, you are humerus over right cheek. Your forearm over the left cheek. Yes. And your palm you have to keep like this. Yes. And posteriorly you should hold your hand in the flexed from down to upward you have to lift. Breathe in, breathe out. While exhalation, lift slowly. Slowly you have to lift. Yes. Lift. Yes. Ask the person how he is feeling, how she is feeling. Leave her. I will ask. Is it okay? Comfortable? Yes. Anyone is doing? Still clarification you need means we'll do.
Hello, sir.
Yes. Who is?
Doctor.
Who is? Dr. Abida. Okay, do it. Do minimal pressure because your father, no, age is?
56.
Eh?
56, sir.
56. Okay. After 50, you should do minimal pressure. You are doing no, then it will not be much pressure, I think. I don't know, you are a strong person. Breathe. Tell father to breathe out while exhalation. Slowly you have to lift it. Yes. Don't do any shaking. Just lift and keep it down. Lift and keep it in normal position. Is it okay? Both sides you do, then ask your father. Both sides you do, then ask your father how it is. Abida, okay?
So please, can you demonstrate once more?
Okay. Very good.
Thank
you. Middle. സാധനം അല്ലേ നമ്മുടെ സ്പെഷ്യൽ സാധനം ക്ലാസ്സിലാണ് ഞാൻ കൊടുക്കാം അല്ല കുട്ടികൾ ഉറങ്ങിയിരിക്കും ഞാൻ പറയാ hello those who want to 1 second demonstration, you keep your this one camera. I'll demonstrate first. Okay, so you want front side or back side?
Just show both sides, sir, please.
Okay. Front, you just observe, we are locking this elbow, we are keeping this area, chin area. This forearm we are locking like this. And here another cheek we are keeping our humerus. And front side I will demonstrate first. Breathe, lift, keep it down. Lift, keep it down. Okay, this much is clear. Okay, and the posteriorly.
Lift patient.
Pardon?
As you are lifting the doctor,
You have to lift the patient a bit upward direction.
I will clarify this. We just observe this.
Lift the doctor in upward direction.
Upward direction. Okay. This one is, we are keeping our hand like this, flexed position, and we are not pushing like this. Pushing means it will move forward. Okay. Keep the patient head 90 degree. Just we are locking like this, and down to up, we are lifting. And after that, if you are keeping normal position, you keep normally. Just lifting pressure is needed. Thank you.
So how many times should it be repeated?
On the patient condition, if patient is not a chronic that much, you can do like this very simple 1 or 2 times, 3 times minimum. If you are doing, it will be relaxation position. You are having any demo, you practice it. I can clarify that.
So what about in chronic condition?
Chronic condition, you can go for the snehana, svedana, lepana. After that, you can do stimulation every day. And if it is needed after snehana, svedana, still difficult structural or the stiffness is more, you can go for that. Manipulation also. Manipulation 1 or 2 times is enough. Stimulation you can do daily.
Sir, what is the difference between stimulation and manipulation, sir?
Oh, you are not there in the first class? Means when I am explaining the stimulation?
No, sir, I joined very late.
Okay. I
Sorry.
think your recording will get about the entire things I discussed. Okay.
Okay, sir.
Stimulation,
Thank you.
manipulation, everything I told in the initial, I think more than 1.5 hours, we were discussing about initially how to do stimulation is nothing but just press and release to increase the circulation and to relieve the pain, a particular area. Manipulation, wherever structural impairment is there, then you can correct by doing the manipulations. If a patient is complaints of neck pain, means no, don't go for all the patient, go for this type of manipulation. Just do it stimulation. Still you are getting thinking the manipulation also needed. Then only you can go for that.
Okay, sir. Thank you, sir.
Okay, thank you.
Sir, any contraindication for this?
Yes, initially I told you are also didn't attended that. I told with all the X-rays and everything, we should select the case for that. Otherwise, it is very difficult. You will end up in the trouble. If you are going for the arthritis patient, if the cervical rib is there or canal stenosis is there, that will not give any result. With the cancerous condition, if you are doing, will not get any result. The fracture, if you are doing, it will go for complications. Okay. Doctor, so many questions are there in the chat box, means we'll see that. In the practical session, anyone is having doubt, we'll discuss. Or else we'll go to our chat box.
Hello, sir. Hello, sir.
Yes. Who is that?
Sir, myself, Dr. Garima. Hello, sir. Sir, I want to ask in which health conditions this thing will be helpful?
Which condition we can do? You are asking like that? Your question is like that, no?
Yes, sir.
You are asking which condition we can perform.
Yeah. In which condition, in which diseases we have?
Pain and neck stiffness is there, all condition you can do the stimulation. The manipulation with the patient morning stiffness and the cervical degeneration or IVDP cases also we can do the manipulations to correct the structural impairment.
Sir, can I ask one question, sir?
Yes, definitely.
After this procedure, can we apply cervical belt for cervical spondylitis, sir? Cervical belt.
Yes.
Neck belt.
You can use the even after the stimulation manipulation. If the case is IVDP, severe IVDP, you want to immobilize the particular area, you can do the bandage. After the bandage, you can use the instead of Motoli Banda in cervical collar base also you can use. And every day during the treatment time you can do. After the treatment patient is admitted, that time also you can do the stimulation. During the treatment time you can perform the Marma massage particular area.
Sir,
concentrate that area.
In a day, how many times we can do this procedure, sir?
Stimulation every day you can do. Manipulation only one time is enough.
Okay, sir.
If it is chronic one, don't go for immediately. The onset is sudden. There is no other swelling. There is no other things. If you are performing the manipulation, if you will get result, means if you are having idea, then you can perform. Otherwise, go for
Yes,
labor, all those things, then you have to do the stimulation and manipulation.
Thank you, sir.
Okay, thank you.
Sir, during expiration, should we lift or
Yes,
during
yes. During
inspiration?
expiration, we should lift. Otherwise, patient also will come along with you. Like this, they will come and they will make it complete. Will not get proper relaxation position. Relaxed position you will get when your patient is performing, doing the exhalation. Any other doubt? Doctor, can you see the chat box? How many questions are there? I think 24 questions for comment or something, whatever it is.
Yes, sir.
We'll
Should
go
we
through
read?
one by one. Now clear.
Sure, sir. Shall I read it to you?
Yes, yes. You just go through, then you tell me.
Okay, sir. Can we start now?
Yes.
So the first question they are asking, one time again, say where to do ice pack massage and where to do hot fermentation massage.
Yes, definitely, wherever the Abhigata is there, Susruta Chikitsa explained Acharya, we can do the Shida Dhara Lepa. The onset is sudden. If it is chronic, after 72 hours, then we can perform the Lepa, then this one, Dhara, then we can perform the hot fermentation. And Leba Dhara also we can use the Agni Leba, we can use the hot water, we can go for the hot fermentation, etc. Okay. If the onset is sudden, if there is no other much involvement of in Marma, etc., or if there is no other involvement of fracture, then you can go for this type of Dara and etc. after 72 hours. Before that, you should not perform the hot fermentation or massage, etc.
Sir, first we have to do Shida Prayoga. Then after, we have to do hot fermentation.
The onset is sudden. Don't go for any other hot fermentation. Go for Shida Virya, Shida Lepa, Dhara, etc. And do the bandages needed. You can put with the Shida Vigeshi Aushadha, you can put the bandage. After that, there is no need of any other hot fermentation. If the chronic case you are getting, then you can perform initially Snehana, Svetana, etc. Now you got point?
Yes, sir. Yes.
Sir, another one question. In what and all conditions we can go for Muruvanna banding?
So where we can learn the complete Marma Chikitsa, we are doing the Marma Chikitsa here online session completely. I think 7 classes, my class is coming. Other gurus also explaining. We can do Murivanna bandage wherever the Marma Kshada is there or Bhagna Sandhi Mukta. After that, we can do the Marma bandage, Murivanna bandage. If you, every day after treatment or back pain or somewhere cervical area, and you can put the any other joint, every day after treatment, you can keep the Murivanna pad and you can do the bandage. That will reduces the pain and swelling. How many times we do the this one stimulation? Stimulation per day, one time is enough. And one sitting, if you can do the 3 or 6 or 9 times, 10 times, we can do. Okay. After that, patient will get relief. Don't go for more. Don't go for 1 or 2. Okay. On the basis of patient condition and the yogi bala, we can perform.
Sir, can we use Kozhikode Taila instead of Murwana?
For what? Means bandaging?
Yes.
I didn't try with the Kozhikode Leba or Kozhikode Leba. When I told one internee to do the Leba, what they did know, they kept after the Leba They tied 2-3 times just Veshtana. Then after 1 hour, patient may got severe heat and there will be burning sensation. Then told why you put bandage. Then they told no, there is no vaccine. They just wait, put laba. Then we did the small wrapping 2 or 3 times of that Kora cloth. Then I told in the cotton jukadi, if you are putting as a laba only, should not keep it as a Vikesha. This is Tishna Vida. Okay, and this one also the Ushna Vidya is there, no? And Tishnata will be there, and the Ushna Vidya drugs if you are keeping acne labor or something, or any Ushna Vidya cotton jugadi if you are putting in the bandage and will not get the Shita Vidya, Shitata. So that's why the Murivanna, even it is a other quality is there, it is having Shita Vidya. That's why we are having putting the Asti Sandhanagara and the Brana Shodhara property this Thaila is having. That's why we are using Murivanna. Now it's clear. What is the difference between stimulation and manipulation? Stimulation is nothing but just wherever the pain is there, somewhere we are doing this press and release that time. Manipulation, where a structural impairment is there, we are doing the manipulation. And to correct the structural impairment, we are doing the Anchana, Pidana, like that.
Sir, please show Marma therapy point in sciatica patient.
Sciatica today is very difficult to show because time is very short. In the coming classes, I think I'm having the lower limb. I will demonstrate. If you are joining the class, we can discuss all the Marma other part. I did not get how to hold the patient. I already told, I think. And what to do after this manipulation. If the inflammation is more and the patient is a chronic condition, you can go for the Snena, Swedana, Lepa, all this kind treatment. Okay, after that, Grivavasti or Nasya, all those things you can perform. Indication for the above manipulation, indication the morning stiffness and the cervical IVDP, all those cases we can do. And should we lift during expiration? Yes, yes. For neck stiffness, we can do this lifting, yes, neck stiffness. But there will be a number of causes also. There will be a chance of stiffness that you have to rule out. Which sneha is used for the dose? Sneha means oilation. You are asking which sneha is used and dose. Sneha means external application. You can use in the neck region. There will be kapha sthana. Kapha involvement is more there. Then you can go for the karpuradi taila, etc. Okay. Or doctor, only for cervical issue this can be performed. Cervical manipulation I demonstrate today. Thoracic and lumbar and other area is coming classes we will demonstrate. Can it be used in chronic cervical? Yes, chronic also we can, but degeneration will not reduce your manipulation stimulation. And you can do the Dara treatment, etc., internally and externally. That will reduce the degeneration. And this stimulation helpful for those who are unable to raise hand upwards. Yes, you can do. I can do traction with the stimulation. One side you can pull, tell them to pull any one person, and you can do stimulation. And can we perform this supraspinatus and subscapularis muscle tear? We can do this type because supraspinatus and infraspinatus and the which muscle is neck region. Trapezius muscle below that supraspine, spine above the supraspinatus, infraspinatus, wherever the patient is having shoulder, we have to perform the stimulation over the neck region also. Is there any contraindication in this condition? Murivanna application. Any contraindicated condition for Murivanna? Neck region, we are not using Murivanna. And is it more beneficial to do stimulation and manipulation after oil application? This after Snana Swedana you can perform. One of my doctorate data thesis on this cervical region, add-on effect on Marma Chikitsa in the cervical region. It was a good result she got. If so, which oil would be recommended? Karpuradi Daila and any other Karposistel Daila, all those things we can use. Shada is there, Murivanna. Repeat about the exhalation in movement manipulation. Namaste, sir. Where does Marma therapy play key role? Which condition? Marma stimulation beneficial over physiotherapy concentration. I think the doctor explained that answer. There is a swelling or edema pain, we can do massage. Don't go for massage. Swelling is there. Do lepa, Marma Diguliga lepa or any other Eladigana, Rasna Dijurna with the Danyamlam. After that, you can perform the stimulation. And will Marma therapy cures the disease completely or temporarily? We can do the structural impairment, immediate result you will get by doing the manipulations. Sir, the Abhigada chronic can we do Shita Lepa? If the Abhigada is chronic Abhigada, no need of putting Shita Virya, you can go for Sneha Sweda. Okay, you are treating as a Vada Chikitsa. What about the Nagaradi level? Nagaradi also you can use if you are performing the bandaging. What is the scoliosis and Marma treatment? Scoliosis we didn't explain today. Coming classes we explain. The person is having neck pain and swelling is also present in the neck area. And manipulation I like to do according to the chronicity. You can do Lepa, Nadi Sweta, Lepa, and bandage, and after that we can perform the stimulation. Sir, can you demonstrate the stimulation? We have already demonstrated how to stimulation the carpal tunnel. That also madam already told. Press and release, press and release. Can we do for cervical manipulation every day? Manipulation is not needed every day. Stimulation you can perform every day. Massage also you can do every day. Can we do manipulation? Loss of lordosis condition, cervical lesion. Loss of manipulation we can do the structural impairment by doing correcting this. Chronicity is this, Snehana, Swedana, Lebana. After that you can perform. Okay. An allopathic doctor says the avoid ovulation. Is it okay to massaging chronic cervical spondylitis? Ovulation, the allopathic doctors are telling different condition. If we are explaining this context and that we can't give more result, we can't finish it. But the thing is, only one thing, wherever it is necessary oil, wherever it is necessary lepa, wherever it is necessary massage, do like that. Don't go for like that. More manipulation, stimulation or massage, and that will land up in the trouble. Types of manipulation. Different manipulation we can do, Dr. Amrita. And wherever it is necessary, in the shoulder joint, knee joint, and the hip region, elbow joint, all joints, especially in the spine area also we can do. When will be the next class? I think Dr. Jessina, you can discuss with the Ayurveda team and they will explain all the details of the classes. Okay. So if we are doing the bandage for the neck pain swelling, how many days should be changed? Saptaha, Somara, Shubandana, Markna, Shutrakyat, and 3 Sadharana Katyam Panchame 3, 7, 5 days Ajay explained already. And on the basis of that, you can, if you are doing the bandage on the cervical, it will come to the axilla also. Because of the sweat, you can change after 3 days. Still any doubt is there? Dr. Binzia. Okay, doctor?
Okay,
Hello,
sir.
Okay, any doubt?
Yes, sir.
Yes. Can I wind it?
Thank you, sir.
Sure, sir. Sir, thank you so much, sir and ma'am, for this wonderful session. Dear participants, the actual session starts from 20th of May. That is, the RACHANA sessions are starting on 20th of May. And there are 23 sessions and 5 modules. Thank you so much, sir. Thank you for this great session. And dear participants, thank you so much for your participation. If you have any doubts regarding sessions, you can contact the coordinator.
So see you in our Ayurveda team. Especially this type of marma, if you are utilizing, if you are in different area of the world, you can study. And moreover, wherever you are practicing, you can do in your home or your relatives, and you can do more thing in the Ayurvedic. So the people, those local area, remote area in the state, if you are in Dubai, UK, anywhere you can practice. That is one thing, the great thing is there in the Marmachikals. I wish you all the success and thank you for inviting the Ayurveda team and thank you for patience hearing all gurus and shishas. Thank you. We'll meet if you are coming in the classes, we'll discuss. And you have a number of questions that we'll discuss. I am ready to explain my level best. Okay, we will train you in the online session. And after this online session, we'll plan offline also in future. After the Ayurveda team is allowing. Okay, if you are perfect in the basic level, then we'll go to the advanced level. Okay, thank you, one and all.
Thank you, sir.
Thank you so much, sir.
Thank you, sir.
Thank you, sir.
Thank you.
sir.